So this is kind of a broadish question, but I think you could handle it, Erica. What is your biggest challenge with clients as a clinical herbalist?
Honestly, sugar. I could say that pretty easily. One of my biggest challenges with clients is sugar. Yeah. I think, I will go with that. And I will also say that, um, making behavioral change is hard. Behavioral change is hard, especially living in, the current state of affairs that we have. We start adding a whole bunch of intersectionality to that bucket, like, economics and race and food deserts and all the other infrastructural nightmares we can think of. Um, Behavioral change is so hard. And the number one the number one issue that I think most of my clients have is, a lifetime of treating the body like crap. I mean, and this is with or without underlying genetic disease, or, I was born with this or whatever. Those kinds of things aside, by the time the client arrives, and I work with mostly adults. I mean, I do work with some children as well. And unfortunately, they're often at the mercy of their parents' behavioral decisions, right? But most of the clients that I work with are adults, and they have led a life of, just like me, being totally dissociated from my body, and really just, pelting it with whatever crap I could. And so, we have over time this like experience of really, really deeply embedded habits, that are held in place by a very deeply embedded psychology surrounding being in the body. And I think overcoming that dissociation and stepping into relationship with body, even if it's imperfect, you're still trying and working towards that body empathy. I think that is hugely challenging. I mean, that I think is the biggest challenge. And I say sugar because sugar for me is like an archetype of what I'm trying to say. Um, so I don't know, hopefully that answers that question.